Okay. All right, that's good. So it's 11:03. Let's go ahead and get started. We've got a lot of good information coming to us today. We'd like to welcome you to our August 15th, 2024 Community Stakeholder Meeting. And just at the top, just a little bit of housekeeping. We want to just remind everyone in terms of accessibility for all attendees, we want to make sure that we're saying our name clearly. Each time we speak, we just want to make sure that we say it each and every time. Since we're not in person, we won't worry about the microphone, but also we do have options for language access and real-time captioning if requested ahead of time. We want to make sure, we live in an era of acronyms. We use them all the time and we become accustomed, but not everyone is aware of our acronyms. So we want to make sure that we are spelling those acronyms and terms and jargon all out so we all know and are on the same page. Again, we want to speak clearly, slow it down, which I tend to do. I get really fast sometimes. So just speak clearly, slow things down. And it's definitely helpful to those who may not speak the same language as us. And it also helps our interpreters and captioners. Some reminders for our speakers. We want to make sure that any major points that you're trying to make, try to summarize those. We don't want to read word for word, every single word on the slide. We want to make sure that we're providing background and contextual information in terms of the information that we're sharing. Excuse me. We want to make sure that we're highlighting key terms that we're using and provide visual concepts as well. So in terms of our images and objects that may be on slides, any diagrams and things of those nature for our folks who may not be able to see the screen or are visually impaired, we want to make sure that we are describing those objects and images. And we have an example there. We want to make sure that we're offering outlines and other tools to help folks to connect to the presentation. And then we also, lastly, want to give our attendees time to process information in between topics and give you time to be able to ask questions and receive those answers. For our introductions, when we introduce ourselves, please, we want to make sure that we are saying our name. We want to say where we're working, what organization, and the role that you currently hold. And this is actually a good point for me to stop, and I'll go ahead and say, if you would, for all of our participants, if you would put that information in the chat, that would be great. Your name, your organization, and your role. And then also, if you want to include any gender identity information, pronouns, any of that information, that would be great. But in terms of coming off mic and introducing ourselves, we want to make sure that you're saying, what your name is, where you're from. You can describe yourself. For example, there are a couple of examples here on the screen. So this one is, I'm a Black woman with curly hair. And for example, with me today, I'm a Black woman, I have curly hair. However, it is up in a bun on the top of my head, and I'm wearing glasses and a black top. And then, of course, any of our speakers, you want to make sure that you are doing the same. Just make sure that we're providing a good description of ourselves for those who may not be able to see the screens. And again, my name is Dorothy Swan. I'm an outreach and member engagement specialist here at DMAS, and I'm sitting in today for Natalie. In our agenda today, we have a couple of great presentations from DMAS staff that are here to impart some good information to us. And then afterwards, we'll have a couple of announcements before we close up. All right, and as I mentioned, you want to make sure that you introduce yourself in the chat. And then we have a question. It says, if you had to evacuate your home for an emergency, what 3 things are you grabbing first that are not people or animals, and why? So if you can think about that and put those answers in the chat as we go along, that would be awesome. First up, we have Marissa Sadler. And give me 1 second, I have her information. I apologize. We have Marissa Sadler, who is the Maternal and Women's Health Program Operation Analyst here at DMAS, and she's going to be talking to us about prenatal and postpartum services. So with that, I'll turn it over to Marissa.
Thank you, Dad. I appreciate the introduction. And again, Marissa Sadler, I'm the Maternal Women's Health Operations Analyst here at DMAS. And I'll give a quick overview. I'll keep it very high level of some of the information that we're currently doing here at DMAS as far as benefits and services as it relates to prenatal and postpartum services. Next slide, please. Thank you. And so DMAS, some of our maternal health priorities, they are very high level, but of course, a lot of these things trickle down into the work that we're currently doing in our unit. And so within the maternal child health unit, we currently serve 4 people. That is myself covering maternal child health. We have someone covering foster care, child health, and also doula services. And so within my presentation, I'll give a deeper dive into some of the things that we're doing as it relates to maternal health, of course. And so some of our priorities right now, as it relates to maternal health, we are focusing on access, utilization, care management, and outcomes. And so within some of these things, we want to definitely focus on our member. We definitely work with the members and providers to ensure that everything is comprehensive, full scope, and we're meeting all the needs from preconception all the way to postpartum in that 1 year after postpartum. And I'll tell more information about that. So here you see, of course, access as we relate to quality health services for both pregnant and postpartum women, utilization, thinking about the services that we render for both postpartum and pregnant members, case management. Majority of our members are currently served within a managed care organization. And so within that, whether you're high risk or non-high risk, you're also placed within one of our managed care organizations. And so that care management is rendered through our managed care organizations. And if you have any specifics as related to high risk health conditions, we will serve the member through care management, excuse me. And also, of course, with all of these, we want to improve birth outcomes. That is one of our major things as it relates to initiatives, projects, services, and benefits, is to just improve overall birth outcomes, excuse me. Next slide, please. And so overview, as I continue to have this conversation with you all and share the great work that we're doing within our unit, I'll share some information on our current maternity dashboard, our pregnancy coverage services as it relates to our eligibility groups, and some of the services and benefits as it relates to our pregnancy coverage for prenatal and postpartum. Next slide, please. And so this is our current dashboard, which can also be located on our DMAS website, and I can share that in the chat a little bit later. My apologies that I did not include that link here. We're proud to say that we approximately cover 40,000 births per year. And so this dashboard here will cover both Medicaid and famous enrollment. And it shows some of the ethnicity, the race, gender, and our age groups, and the different localities in which we serve these members. Most of our members are within the Tidewater and Northern region, and also Central Richmond, excuse me. And so this just shows an overview of that. And so this is also updated twice a month, the beginning of the month and the 15th of every month, which shows an overview of what services we cover. And so not specifically for pregnancy, but you can also take a look at the other member eligibility groups if you were interested in that as well. Next slide, please. And so as I shared before, Medicaid benefits for Medicaid and famous moms. And so when you think about that, we think about full care benefits during our pregnancy. And so each of these that are listed here are all comprehensive and have been updated to ensure we are covering all scopes of the spectrum from mom, as I shared before, from postpartum all the way to prenatal to postpartum, 1 year postpartum after birth. And so, as you can see here, we cover birth control coverages, birth control, prenatal doctor's appointments, doula services, dental, 12 months postpartum, transportation, lactation services, and also added benefits from our managed care organizations. When you think of added benefits, think of enhanced benefits. So things that are outside of your regular managed care or Virginia Medicaid coverage services. And so when you think of added benefits, these are things that are enhanced and also added on to your package as you are with a managed care organization. In our current managed care organizations, we have 5, serving with Aetna, Anthem, Molina, Centera, and United Health. And so each of these not only cover the same services, but they also have different added benefits as it relates to diapers, baby showers, strollers, different incentives to ensure that the mom is receiving the services that she needs. And so it's awesome. And taking a look at our website, you'll be able to see the different things that our managed care organizations are currently covering and the great rewards that are offered to members as they are enrolled in their specific MCO. Next slide, please. And so I'm happy to share that we, as I shared before, when you think about preconception all the way to postpartum, we are now happy to cover moms during their postpartum period for currently 12 months postpartum. This expansion was effective actually July of 2022. So we did a lot of work to get this because previously members were only served for 60 days. And so we knew that beyond 60 days, moms needed and women needed more coverage and more support throughout that because we know the postpartum period can be different. And we want to make sure that moms are served and covered throughout that. And so for the postpartum period, mothers are covered for as it relates to anything from behavioral health and mental health services, dental care, substance use disorder, any of those things that I shared before as far as dental, transportation, everything is covered still comprehensively under the postpartum expansion for this. And so continuous coverage is a permanent policy. And I'll talk about the other coverage groups as it relates to what that looks like as far as 12 months postpartum coverage. So as you can see here, it is very expansion for some of the services that are offered throughout the postpartum period, but we want to ensure that moms receive the accurate services that they need. Next slide, please. And as we think about this, we've done a lot of work to ensure, along with Dot and Natalie's team, to perform outreach and communication. And so in our own scope of things as it relates to maternal health, as you can see here, we have 2 flyers. And we currently are mailing flyers to our newly enrolled postpartum and prenatal members. And there's also a project that we're doing with the governor's cabinet to, as you may have heard of, called the Partnership for Petersburg. And so we're sending mailings out to moms, whether or not they've had a care visit or not, as it relates to Partnership for Petersburg, which is our first slide to ensure members can get the services that they need. And as you see here, we're actually sharing with members where they can go to receive these services as it relates to both prenatal. And then we have another slide not pictured here, but also for postpartum. So what to do before and after pregnancy, what that looks like. And we've been grateful to work with Dr. Brazil in Petersburg to have a clinic open on the weekends and also during the weekday to ensure that members are getting the services, because specifically for our Medicaid members, we want to be flexible with them. And we know that the weekdays may not always be the ideal time for members to come in for an appointment. So we've also had extended clinic hours as it relates to the Partnership for Petersburg. And so super excited to have that and grateful to have the opportunity in partnership with Bon Secours. And then to your right, you'll see the welcome new pregnant member flyer. So we've made a lot of updates to that to ensure that members are aware of the current services during and after pregnancy. And this is just an info one pager as a resource to serve both our managed care and our fee-for-service members to allow them to know what services are available for them, the benefits that are currently for maternity members, and how to access those services. Next slide, please. And so next is another one of our benefits. Our newer benefits is the doula benefit. So we're happy to share an overview of this, and this was also implemented in 2022, July. And so currently I'm happy to share that we have 171 state certified doulas enrolled as of currently, and 133 Medicaid enrolled doulas. So we've had a lot of work since inception and implementation of this, also in partnership with the Virginia Department of Health. And as you can see, the benefits overview for an enrolled doula and for a member to serve, they will receive 1 initial prenatal visit, up to 3 additional prenatal visits, which is the max, and 4 postpartum visits, and also attendance during labor and delivery. So we know that the doula is also in support, and there to support the member and also the provider, and being another voice, added voice for the member as they're going through their pregnancy journey. And so this here is just an overview of what it looks like for a doula to enroll, to receive services, and to be able to render services to a Medicaid member. So I don't want to go into depth of all this, but I'm happy to answer questions after as well for the doula benefit. Next slide, please. And so our next, one of our newer benefits is our famous prenatal coverage. So this is full coverage for pregnant women who do not meet the immigration status rules with coverage. And so as I shared before, these members will not receive postpartum coverage for 12 months, but they will still receive the 60 days postpartum coverage after their child is born. And so these members do not necessarily receive the comprehensive services, but they do have specific services that are rendered to them as well. And these women do not specifically qualify for Medicaid or Famous Moms. So we decided Medicaid New was also important that we cover this population of members. And so that was where the famous prenatal coverage was identified and created as well. And so this is a quick member flyer, which is also located on our DMAS website if you're wanting to learn more information about that. Next slide, please. And that covers it for our maternal health overview of both prenatal and postpartum services and benefits in which we offer our members here within Virginia Medicaid. So I'm happy to answer any questions you all have. And outside of that, if you all have any other questions outside of this presentation, you can please share them with babysetsvirginia@dmas.virginia.gov, and we'll be sure to get to you and hopefully answer your questions as quickly as possible. So thank you for your time.
Thank you, Marissa. And if there are any questions, you can go ahead and put those in chat, and then we can have those addressed. And unfortunately, I cannot see the chat. Rachel, are you there? Are you able to?
We do not have.
Are you unable to? Okay, thank you so much. All right. Well, we will go ahead and move on. Next up, we have Lynn Hamner, and she's a senior policy analyst here at DMAS, and she's going to speak to us today and provide an overview on school-based services and the role of the Medicaid coordinator. So with that, I'll go ahead and turn it over to Lynn.
Thank you. Good morning. As she said, my name is Lynn. I'm the senior policy analyst at DMAS, and my main role here is to work with school services. And as far as the question that you asked in the beginning, what would you take out of your house other than your dog? It would be photos. And if I could grab any mementos or special things that people have made for me, that's what I would take. Next slide, please. The first part of this, I'm just going to give a brief overview, very high level of what we do with school-based services. So we the schools receive federal reimbursement for providing covered medical and behavioral health services for Medicaid students. As we know, if children have bad attendance or they're not feeling good, they have health issues, behavioral health issues, all of that will impact how they learn and will set them up to possibly not be successful. So the school services are to help with that. Next slide, please.
Sure.
Thank you. So we passed a state plan amendment that was approved by CMS in September 2023. The main change was that in the past, only students, Medicaid students with an IEP, which is an individual educational plan, were able to access these services, but now all eligible Medicaid students can receive those services. They also expanded some mental health and behavioral services. Some nursing screenings are now able to be done, and some changes to the transportation. Next slide, please. So when you think about school services, you probably think about nursing. That's probably the first thing that comes to mind, but we have a whole array of services and things that we can connect the students to that might be helpful. And you also have your outside providers, your community providers. And so when you add the community providers with the help they're also getting in the schools, it really helps the child to be successful and help them to have continuity of care. Next slide, please. So there are direct service. You can prepare for the service, you provide the service, that's your face-to-face contact with the student. There's got to be documentation. If you don't write it down, it didn't happen. We need good documentation. And there's program planning, as well as there's other activities where we can outreach to parents and families. If they need help signing up for Medicaid or renewing their Medicaid, we can help with that as well. Next slide, please. These numbers might be off a little bit. This has been updated since I did this slide presentation, but the local education agencies are the school divisions. Not every school division participates in the school-based services, but they are more than welcome to join in at some point. Next slide, please. And this just shows you participation by service. Again, this has probably changed a little bit since I did this slide, but these are the different services. As you can see, OT, PT, and speech are utilized quite often. Next service, please. Next slide, please. I'm sorry.
That's okay.
And this is just a high level overlook of how they do their reimbursement. We use something as far as the staff called a random moment time study, and each of the staff members that participate in this go in and they answer questions. So it will ask you if what you are doing for the student, what are you doing for the student, and is it a medical or an educational thing, because the educational things are not paid for. So if you choose medical, then it goes down a line of questions that go along with that. Is it an IEP, non-IEP student, etc. And that's how they decide the percentage of the reimbursement through the time study for the staff piece of it. Next slide, please. Then we have the Medicaid coordinator, which is the other thing that I was asked to talk about. The Medicaid coordinator has a lot of responsibilities. They are very busy people. They help to run the program within the school. They ensure program integrity. They answer all kinds of questions for providers. They make sure everything is up to date. They help with cost reports and just lots and lots of stuff. Next slide, please. They wear many hats, and we'll talk about those. Next slide. So the ringleader hat, coordination. Like I said, they will help families with Medicaid. Medicaid can be a little bit complicated sometimes, and it's nice to have a resource to go to get help with that. They maintain a good rapport with the finance staff, their special ed staff, their directors, their transportation staff, and their human resources staff. Next slide, please. The fedora, or the business hat. They determine if providers meet the requirements to participate in that time study that we just talked about. Some of the other things they do, they have an eligibility list that they match to get the number of students enrolled in the school. That's compared to the number of Medicaid students. That's another percentage that's used in their cost report. And they prepare that annual cost report, and there are a lot of elements that go into that as well. It takes a very organized person to be a Medicaid coordinator, as you can see. Next slide. They have a team hat, which is for monitoring. They monitor the participant list for the RMTS, the time study. They monitor how participants' salaries are provided. They monitor for billing completeness and accuracy, sorry. They provide updates to direct service providers, attend quarterly Medicaid coordinator meetings, and there are a lot of trainings for them as well. We just finished up a series of 101 trainings, and there were several days, I think it was 5 days total, of trainings that they received to be able to do this job. Next slide, please. The compliance hat, they have to make sure that the participants are responding to their moments. And when we talk about moments, as far as getting the staff percentages, so you'll get an email and it'll say, what were you doing between this time and this time with this student? So they make sure that the staff fills all those out. There's also a training for all the staff to do that goes along with that as well. They monitor the documentation, making sure that everybody writes down everything that they've done for the student and how they responded to that treatment, etc. And they have to keep all the records available and complete for a DMAS audit review. Next slide, please. And they have a hat of knowledge. They are also trainers. So we train them, and then they train their staff and help their staff understand the ins and outs of the programs and what needs to be done. Next slide, please. It takes a team. We work with the Department of Education. I am on the phone with them almost daily, getting updates and just working together and figuring out how to plug in holes as needed. And that's it.
All
Any
right.
questions? Sorry, I
Thank you.
talk kind of
No,
fast.
no, that's all right. Thank you so much, Lynn.
Uh-huh.
And I understand there's a question, and Rachel, I think, is going to assist us with that because I cannot see the chat.
Sure. So the first one was, do the famous prenatal clients have doula coverage?
Yeah, I was just in the chat about to answer that question. So as far as doulas in the famous prenatal, excuse me, I'm going to put the list of actual covered services for famous prenatal coverage and what is covered by that. Doulas are not covered under the famous prenatal service. So I'll put the actual list of what is covered. And also to the question around doulas and the current areas that are localities that are covered by more or less, I'll actually add that list in there as well of current areas that doulas are covered in if they're more in a particular area than another. We currently have a doula analyst who is a specialist around that, but I'm getting information in regards to doula localities.
All right. Thank you, Marissa. And were those all the questions for now that you see, Rachel?
Those were, Mark had said that he could not qualify for Medicaid when in the IDEA program, that they said he had to be 18. If anyone wanted to comment on that.
Or is that something we may need clarification on?
Yeah, they may need to
Okay.
check with eligibility on that, perhaps.
Okay. So Mark, this is Dot. So if you don't mind, would you email that question to us and you can send it to, actually for you, you can send it to our MAC email address and I'll make sure our subject matter experts get a chance to review that and respond to you. Thank you. All right, so just a couple of announcements. Seemed like we got through this pretty quickly, but our next meeting will be held on October 17th, 2024. And the topic for that one will be our members and the impact of our members. Also, we need you to help us spread the word about Virginia Medicaid and in particularly the Medicaid Member Advisory Committee. We take applications year round for that. It is a rolling application process. So when folks apply, their applications may be on file for a year or so, especially if the committee's full. And then each year we do some sort of recruitment. So any of the members to which you're engaged with, please encourage them to apply. And we've got the QR code here for you all to scan here for convenience. Also, we encourage you to stay connected with us. We've got our DMAS website and Cover Virginia websites listed here, those web addresses, and then also how to stay informed and keep connected to the community outreach and member engagement team. Again, we've got our page that links, well, we have a page that links right off of the Cover Virginia website. And then also we've got some resources for our Medicaid members in Spanish and also in other languages. So we've got those links listed here. And again, just to make sure that everybody is aware that many of the documents that are housed on our DMAS website are in both English and Spanish. So if anyone has any type of issues or questions about language services, they can always contact our civil rights coordinator at dmas.virginia.gov. And again, to stay up to date, we've got these QR codes that you can scan that goes right to these websites that we just spoke about. And then also we've got some social media presence as well. You're encouraged to connect with us with Cover Virginia on Facebook, Instagram, and also I can't stop saying Twitter, but apparently X pages. And are there any questions at this time? Please put them in the chat or you can raise your hand. And I am actually, since we have a little bit of time, I'm going to stop sharing the screen so I can actually hopefully see the chat. And then I wanted to maybe go back to the top to see if there were any responses about things that people would take with them. I just didn't want to forget that piece of it. Let's see. Did anybody put that information in the chat? Well, actually, it doesn't look like it. So, and that's fine. All right. So if there aren't any further questions, we're going to go ahead and give you this time back in your day. And we hope to see you again on October 17th. So have a good day, everyone.